If you're over 60 and you've started noticing small notches at the neck of your teeth, right where the gum meets the enamel, do not ignore them. Most people brush past these tiny grooves for years because they don't hurt at first. They look small, harmless, and easy to dismiss. But to a dentist, they tell a very different story. These notches are not just aging. They are not simple wear. They are not cavities in the usual sense. They are structural warning signs that your teeth, gums, and bite forces are under strain. And when they deepen silently, they can compromise your enamel, your roots, your nerve health, your bite stability, and even your long-term ability to chew. These grooves are called abfraction lesions, and they behave very differently from decay or erosion. They occur when the tooth bends microscopically under pressure. Yes, teeth flex. At the gum line, enamel is thinnest and most vulnerable. If that area is repeatedly stressed, microscopic pieces break off over time. The notch gets deeper. The root becomes exposed. Sensitivity increases. And once the lesion becomes too large, restoration becomes more complicated and less durable. Most seniors never connect these notches to symptoms they already struggle with: tooth sensitivity, cold shocks, gum recession, cracked fillings, shifting teeth, or even headaches. The truth is that abfraction is a mechanical problem, and mechanical problems worsen predictably unless the underlying forces are corrected. To understand what's at stake, let's walk through 10 common mistakes older adults make when they ignore abfraction, and what those tiny notches really mean. Mistake number 10, assuming notches are just aging. Many seniors believe these grooves are simply wear and tear. But aging alone does not create sharp V-shaped notches at the gum line. That shape is characteristic of stress-induced enamel loss. Research shows that abfraction occurs when the tooth bends under uneven bite pressure, leading to enamel microfractures. The danger in dismissing this as normal aging is simple. If you believe it's harmless, you never treat the cause. And untreated abfraction only moves in one direction: deeper. Mistake number 9, thinking brushing too hard is the only cause. Hard brushing can contribute, but it is rarely the primary reason for abfraction in seniors. Studies show that even people with perfect brushing technique develop these lesions when they have. Nighttime clenching, bite misalignment, missing molars, shifting chewing pressure forward, worn out dental work. These forces concentrate at the neck of the tooth. Brushing may accelerate surface damage, but the origin is mechanical stress. Treating only brushing habits will not fix the flexing forces that created the groove in the first place. Mistake number 8, ignoring increasing tooth sensitivity. Those sharp zaps from cold water, sweet foods, or cold air are not random. When the notch deepens, dentin becomes exposed, and dentin contains thousands of microscopic tubules leading directly to the nerve. Seniors often attribute this sensitivity to age, but abfraction is one of the most common mechanical causes. The danger is that sensitivity signals active change. The notch is progressing. The nerve is becoming more reactive, and deeper damage becomes far harder to stabilize. Mistake number 7, missing the connection between gum recession and abfraction. Most seniors understand gum recession as a gum disease issue, but abfraction not only exposes the root, it accelerates recession. When enamel chips away at the neck, the gum has less structural support and gradually retreats. This makes the root more vulnerable to decay, wear, temperature sensitivity, future fractures. A deep abfraction combined with recession becomes a structural weak point that can destabilize the entire tooth. Mistake number 6, not recognizing that abfraction weakens the entire tooth. A notch may look small, but its structural impact is large. When the enamel at the base weakens, the tooth becomes more susceptible to cracks, especially vertical fractures. These are among the most serious injuries in dentistry because they often require extraction. The earlier the notch is addressed, the more predictable the outcome. But once a lesion destabilizes the base of the tooth, fillings and crowns become more difficult and less durable. Mistake number 5, overlooking the role of nighttime clenching. Nighttime clenching is extremely common after 60 due to stress, sleep disruption, arthritis, and airway changes. During clenching, forces can exceed 200 kilograms of pressure. Teeth do not break under that force, they flex. And that flexing concentrates at the weakest anatomical point, the neck of the tooth. Most seniors never feel themselves clenching because it happens during sleep. But abfraction lesions are one of the clearest signs that nightly forces are too high. Mistake number 4, not replacing missing molars. When molars are missing, bite forces shift forward onto teeth that were never designed to absorb that much pressure. Premolars and canines take the load, and abfraction develops where that stress accumulates. Many seniors live for years without back teeth, believing they can still chew fine, but the long-term consequence is predictable. Overloaded front teeth, notching, gum recession, cracked fillings, and instability. Mistake number 3, ignoring dry mouth as a contributing factor. Dry mouth is one of the most underestimated dental risks in older adults. Medications such as antihypertensives, antidepressants, antihistamines, and diuretics all reduce saliva. Without adequate saliva, teeth lose lubrication and natural cushioning. Friction increases. Enamel wears faster. Dry mouth does not cause abfraction directly, but it accelerates progression and increases the risk of root decay once dentin is exposed. Another overlooked factor is the impact of systemic conditions. Chronic conditions such as diabetes, osteoporosis, and vascular disease reduce the tooth's structural resilience and make enamel more susceptible to mechanical stress. Mistake number 2, waiting until the notch becomes painful or visible. Abfraction rarely hurts until it is advanced. The nerve reacts only when the lesion is deep and dentin is exposed. Most seniors seek help only when they notice strong cold sensitivity, visible grooves, chips at the gum line, difficulty chewing on one side. But at that point, the tooth structure is already compromised. The moment you notice a new or deepening notch, it deserves attention, not observation. Mistake number 1, believing that small notches don't impact overall dental health. The most important misunderstanding is thinking abfraction is cosmetic. It is not. These lesions are structural. They indicate that your teeth are experiencing stress that affects bite stability, jaw comfort, chewing capacity, root health, gum health, and long-term tooth survival. When the enamel at the base of the tooth weakens, the entire system above it becomes vulnerable. Abfraction is not an isolated defect. It is a sign of broader functional imbalance. And here's the bigger picture many seniors never hear. Abfraction doesn't happen randomly. It is a message. It tells you your teeth are absorbing forces they were not designed to handle. When you respond early, the solutions are simple. Correcting bite pressure, replacing missing molars, addressing clenching and grinding, strengthening enamel, managing dry mouth, restoring early lesions. When you respond late, the solutions become more complex. Deep fillings, gum grafts, crowns, root canal treatment, tooth extraction, implants, but none of this is inevitable. Abfraction progresses slowly and the body gives clear signals long before a tooth fails. Your teeth don't weaken because time passes. They weaken when mechanical forces exceed what the tooth can absorb. Listening to those early notches and understanding what they mean is one of the most powerful ways to protect long-term oral health after 60.